Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Keri Brookshire-Heavin, who is the Senior Vice President, Chief Nursing Officer, and Chief Operating Officer at Phelps Health, about the nursing challenges in a rural healthcare setting. So, hi, Keri, how are you?
I'm great. Thank you. How are you?
Of course. Thanks for being here. I'm doing well. Thank you for asking. So let's get right into it. Obviously, there's all kinds of different challenges within nursing at different health systems of all kinds of shapes and sizes. So I wanted to pick your brain today about what healthcare is like for nursing in a rural setting. So can you tell me a little bit about Phelps Health and where it's located?
Sure, absolutely. We are in Rolla, Missouri. If you're looking at a map, we're sort of right in the center.
Mhm.
So we serve 6 counties and about 250,000 residents or patients. But we're about 2 hours from all of the city areas in Missouri, from St. Louis, from Springfield, from Columbia. So we're kind of right in the middle of everything.
Mhm. Absolutely. I guess my first question right off the bat is how do the healthcare needs of a rural community differ from the needs in a more urban environment, if they differ at all?
No, that's a great question. I was kind of thinking about that this morning, and really, I think the actual healthcare needs are quite similar.
Hmm.
We face chronic healthcare conditions. We see the same sort of issues, but I think where we really see differences is accessibility
Hmm.
for the community in the rural setting. So, we have chronic disease, we have heart disease, we do on with our community health needs assessment, for example, we see obesity, we see lack of education about primary care importance, things like that, which is really not probably a lot different. But what we don't see in our area is resources to address a lot of those issues. That's a challenge. We see a lot of our residents, for example, they have no transportation to get to
Mm.
healthcare. We don't have a public transportation. We don't have a bus. We don't have a subway. We don't have things like that. So that's a challenge. Even in some of these rural settings, we we try to think outside the box of how to meet healthcare needs. And so maybe if you were going to use telemedicine to serve some remote populations, some of our community members don't have reliable internet access. So things
Mm.
like that are not even an option. So accessibility is really a challenge for us.
Absolutely. And I'm sure that probably extends to nurses as well, like you mentioned with transportation and having reliable internet. So how does nursing look different in the environment that y'all are in, and what's kind of the dynamic like with the community?
So I think when we look at nursing in this environment, we have sort of had to change our philosophy over the years. When I started nursing, and I won't say how many years ago, it's been a lot. Uh, you sort of had this concept of getting a basic knowledge in med surg before you move to a specialty, and it was not unusual to hire experienced nurses into a variety of positions, but we don't see that anymore. So we're really focused on partnerships with local colleges, nursing schools, and nursing programs, and really trying to find ways to get students here to experience what we have to offer at Phelps Health, because we
Mhm.
believe we do have a great nursing environment. But what we have found is our workforce is primarily unexperienced new graduate nurses that we have to
Mm.
provide experience too. So we sort of change our mindset from we're going to hire and look for all of these experienced individuals because they're not there for us, to let's grow programs to grow experience and make new nurses experienced nurses, creating support systems, new training programs, extending training to start new graduates in specialty areas, uh,
Mhm.
starting programs to get students in the door before they even become nurses. So For example, we have a program where we pay students to come and do their internships with us. So it's
Wow.
paid during school. For a student, it's living the sweet life. You have to do that internship anyway to graduate. But
Mm-hmm.
here's an organization that will bring you in the doors and pay you to be here as a student, but also give them exposure to nursing. We
Mm-hmm.
want all of the students that we can get the more students we get, the more new graduates we tend to get. But what we're also seeing is that those nursing students are doing better on state boards. They
Mm-hmm.
are more successful at 1 year for retention. When we look at retention, we're seeing that rate increase as well. So we're really just trying to be creative and provide a great experience for nursing students and that new grad nurse, use clinical simulation training to try to prepare them, things like that. And growing our own training programs, residency, opportunities for students to get experience and feel engaged and feel valued. So to focus on what is really our driving um, workforce is
Mm-hmm.
that new nurse.
Absolutely. Yeah. And I know, health systems everywhere having issues, with like older generations of nurses or more tenured nurses kind of aging out of the workforce and retiring. And it's kind of hard to get nurses to stick at the bedside. So is that kind of a similar situation? How does
Absolutely.
how does the retention outcomes look?
Our retention outcomes are good or at the state average. We definitely
Hmm.
compare ourselves in Missouri to Missouri Hospital Association puts out a workforce report, and we sort of watch our trends compared to those in our region and across the state. And we are similar as far as retention, although these programs, we're starting to see that retention rate increase, especially at 1 year right now.
Hmm.
They're new enough programs. I don't know that we can see that 2 year data yet, but we're encouraged by what we're seeing.
Hmm.
Um, but yes, we do definitely see the challenge of nurses getting out of school. They start at the bedside, and even within a year, they're maybe transitioning to what I say are sort of these alternative roles that nurses
Hmm.
can now fill. I would say you have a unique role as a CNO for health leaders, or you're interviewing nurses and you're talking to nurses. Well, there's just all of these new opportunities, and nurses are grabbing a hold of those. And
Hmm.
I think it's great to
Hmm.
see nursing expanding and new ways to practice, but it is difficult at the same time to sort of retain nurses at the bedside.
Absolutely. Yeah. And I will say I myself am not a nurse, but I'm
Oh, okay.
definitely, yeah, no worries. But I do get that a lot. People ask me if I'm a nurse. Yeah, because like you're saying, there are so many different things that nurses can do
Yes,
now,
absolutely. Absolutely.
within the industry. So yeah, I'm sure that one day nurses will be doing what I'm doing and, interviewing each other. So that's really good to hear though that the strategies that Phelps Health is implementing are working for retention because I know that that's a struggle for many health systems right now.
Absolutely.
Yeah, so I wanted to circle back to something you mentioned earlier, which is virtual care and telehealth. So how do you think virtual nursing will have an impact on rural healthcare systems?
So I think that's a great question. It's something that we're just sort of starting to plan for, I would say. Um, I know there are hospitals in Missouri, and some of my colleagues that are CNOs and other organizations are using virtual models to assist bedside nurses. I think in different ways. For me, I think about the experience level and comfort level of the bedside nurse. We do have a young nursing workforce. And when I say young, I'm not talking about age as much as experience.
Hmm.
And as a nurse, the new graduate nurse is fantastic. We love it. We love new ideas and we love to embrace these individuals. But we also realize that nursing is stressful and
Hmm.
you want resources. You want experience to be able to ask questions and turn to and get insight from. And so our focus this next year is going to be sort of looking at how do we develop that concept of a resource nurse. And I fully anticipate that will be a telehealth type position, sort of to
Hmm.
extend the nurse's ability at the bedside. Um,
Hmm.
I I personally always think about the new nurse and taking care of what are sicker patients quite often, and do they have the resources and the backup and the experience when they do need that. So for me, I think that's probably our first area that we'll focus on. But
Hmm.
I think there's so much potential there for nursing, from patient education prior to discharge to remote monitoring of patient indicators to assist and extend the ability of those that are at the bedside. So I kind of feel like it's a limitless thing. You have to pick
Hmm.
your starting point. So
Absolutely. Yeah. Yeah, and I'm wondering as well, I know, with virtual nursing and new technology and things like AI, a lot of it is very, bright and shiny and new and expensive. And I know that
yes.
even for larger healthcare systems in, more populated areas, it can be hard to kind of make that pitch to the CFO to invest in that. So is that different in a rural setting? Is it harder to do that?
Um, I think I think it all depends on the financial status of your organization. We're very
Hmm.
fortunate, and we do have resources that we can dedicate to that. Our organization has really embraced technology, and we do try to look at using technology to do things better. But as a CNO, I think a big part of that is my relationship and partnership with our CFO to really be able
Hmm.
to communicate the needs and the vision and sort of the financial case as well for
Hmm.
why this may have cost up front, but what value does it bring in the long run? But I think in rural organizations, that's a challenge in general. A lot of times, finance and healthcare, it's difficult. You don't have extra to invest in those types of programs. You are truly trying to keep up with operations and equipment purchases for capital budget and things that um, just to keep operations going and up to date, you don't necessarily have the resources to invest in those technologies. So
Hmm.
that's a difficult struggle in a rural setting.
Absolutely. And I'm wondering how can CNOs kind of be advocates in their community or like even for policy with legislation about, getting those resources or even things like public transportation for patients and kind of some of the things that we talked about earlier.
Mhm. Well, I think there are a variety of ways. I Awareness for CNO for sure. You need to know what is out there in legislation. We have a government affairs department, research department, and so I do talk with them and stay in the loop of legislation that's coming, discussions that
Hmm.
are happening with legislators, answer questions and get involved. I try to stay active with MHA information about legislative issues, but also really looking at grant opportunities and ways
Hmm.
to fund programs that we may otherwise not be able to do. I think that that's important as well.
Absolutely, yeah. So then, my last question for you is, do you have any advice for other CNOs in rural healthcare systems?
Oh my goodness, how long do we have?
As long as you
That's
want.
the advice. Um, I feel really fortunate to work in rural healthcare. I think there's a uniqueness about rural healthcare that I love. I find it very rewarding. But I also think it's important to continue to sort of think outside the box and not just try not to be limited by the ruralness of the area you're in. I have to challenge myself to stay current and to challenge our way of thinking. I have a group that I network with, a group of CNOs that are from other rural organizations, but there are a couple organizations that are larger organizations, and we really kind of just talk about issues that we're all dealing with, and they're all the same.
Mm,
We
yeah.
may deal with them differently, but so connections and relationships are huge with other leaders, but also in your organization. I wear a lot of hats. I am a chief nursing officer and a chief operating officer, so I definitely have a different role, and which I love. I think it's a great benefit to me to be able to really have impact change because I can deal with not just nursing, but other areas.
Mhm.
But strong relationships are key. I work closely with finance um, and really communicate needs and where we're at and what challenges we're facing. And it's not unusual for me to sit down with my CFO and we're sort of strategizing. How do we improve? Let's say, for example, we're working on operating budget. We're talking about how do we improve and reduce ratios and different initiatives in nursing to bring nurses here, make nurses want to practice here, keep nurses here. And her recognition of those issues is because we built that solid relationship. So relationships are everything. And I think that's really a key thing. But for me, sort of my advice, and this is my personal philosophy, is to be better. I just say that's like the simplest way. I always try
Mhm.
to be a better human, be a better leader, do better with quality, do better with experience, and never get stagnant. Always
Mhm.
try to keep it moving and try to look at how do you keep improving. And I sort of keep that mindset and ask myself that a lot. Um, if you're not really into, let's say, legislation, you kind of mentioned that.
Mhm.
How do you get better at that? So thinking about that as an individual and a professional, but also thinking about that organizationally, I think that's really important. And then I think taking care of yourself is important too. I've been in nursing a long time, and I did spend a lot of years not taking care of myself, not
Mhm.
taking care of or focusing on work life balance. So while I don't always do great at that, I really try to encourage my leaders to do better than I did along the way with that. And for me, I really think it's important, and I think it's important for all leaders, focus on growing the next generation of leaders.
Absolutely.
Nursing leadership is a difficult job and it's unique. It's not like leading any other area, and probably every leader says that about their areas, but you have to grow those people and find opportunities for them uh, to sort of meet what they're needing from the position and to find ways for them to be successful, to keep them in the roles and to sort of grow. For me, I look at the future of nursing in my organization and I won't be here forever. So, how do I grow people to keep nursing moving and sort of being better at what we do? So, that's what I think drives me and probably what advice I would give to other CNOs because I get so much reward out of that. And that kind of fills my bucket, if you will. And I love that to be able to have that impact.
Absolutely. And I think that that's, a beautiful message of just be better, and think outside the
Yeah.
box and build community.
Yes.
That's our goal here at Health Leaders is to help, CNOs and all kinds of healthcare executives find each other and brainstorm and strategize. So yeah, I agree. Well, thank you so much, Keri, for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights. And thank you so much to our audience for listening.
And thank you. I appreciate the opportunity.
Of course, thank you.